Ademo, and you Folake. Those attendants you see in pharmacy shops or chemists are supposed to dispense medication based on prescription. Asking them to dispense medication to you based on your symptoms is the same thing as self-medication because they are not trained to make prescriptions and you are not doing yourself any good. Hey! If you find yourself in any of these shops for any reason as a first port of call, please ask to see the pharmacist or the nurse that is on duty. At least they'll be able to properly advise you within the ethics of their profession.
That's right.
That a particular medication was given to Yabashira for the same symptoms that you are having does not mean that that medication will also work for you. That is the reason why, after describing your symptoms to doctors in the hospital, they ask you many other questions. They examine you and even request for some other tests to be done to enable them determine what is wrong with you. And the reason is because many ailments present with similar or even the exact same symptoms. Or you think they ask all those questions because they have nothing else to do?
For talk and sense now.
And you, Dr. Obinna, that you have made a correct diagnosis does not mean you can just scribble prescription for Adamu.
Really?
I know there are many people that you need to attend to, but that extra 1 minute that you spend explaining to Adamu why you made that prescription, how the medication should be taken, whether with food or without food, with likely side effects and what to do about them, could be the difference between successful treatment and therapeutic failure.
That is very, very important.
Amaka, always remind the doctor if he fails to give you these explanations. And very importantly, if any doctor or a hospital gives you medication in a dispensing sachet like this, please do well to remind them to write the name and how to take the medication at the back. Because 1, you may forget the instructions that have been given to you. And 2, it could be the difference between life and death should you be unlucky to experience adverse drug reaction.